All right, good evening, everybody. My name is Dr. Robert Brown with Elite Chiropractic and Rehab in Bloomington, Illinois. So tonight we have a very special webinar for you, and I'm very excited to go over this for you. So I'm just adjusting my speakers here. I think we're set up, we're ready to go. So tonight we're gonna present to you Thrive. We're gonna talk about how to age gracefully and how to love life. So I'm very excited to share this information with you. So let's get started. Okay, so what is your expectation of aging? What if we were to tell you that you have the ability to not only age gracefully, but to also age with style, vigor, and all of the energy needed to feel like you were in your prime? And a lot of you might be thinking, oh, there's no way. You know, once you get old, you fall apart. You start to deteriorate. There's this thing called arthritis that sets in. But I'm telling you, there is a better way. And tonight we're going to talk about some specific strategies that will make this your reality. And this is our vision for every member in our community. And so most people operate from a place where they have an expectation of a limited life. They expect deterioration, and this is thought of as normal. And that's truly sad. You know, a lot of seniors, they give up on their hobbies. They make excuses to their family. They stop truly experiencing life and everything that it has to offer. And the challenge is that aging is guaranteed, but thriving is by choice. And the key is to make conscious and intentional decisions when it comes to health, regardless of how old you are. And so I'm going to ask you some very important questions here. So number one, do you want to be a sedentary senior who walks around in pain and is unable to experience life? Number two, do you want to gain an extra 30 pounds in your later years simply because you're unable to move? Number three, do you want to watch your grandchildren playing in the park while you sit on a bench instead of joining in with them? Number four, do you want to be on the sidelines of the dance floor when your grandchild is getting married? Number five, do you want to stop traveling because you just simply don't have the energy? And number six, do you want to give up most of your hobbies because you're physically unable to enjoy them? Now, hopefully you answered no to every single one of those questions. These are somewhat rhetorical questions. However, if you did answer yes to any of them, you might as well just turn this off right now, because this webinar is not for you, okay? Let me repeat that. If you answered yes to any of the 6 questions, just have a good night. See you later. You know, thanks for tuning in for these 5 minutes. But hopefully you answered no to all of them, and you want a better way of doing things. And that's why we are here tonight. So now, how long do you expect to live? What we have determined now is that the average age of life expectancy in America is now a little over 79 years of age. Coincidentally, we were ranked 31st on that, and Japan was ranked first. And we are living longer and longer. And Benjamin Franklin said it best: in this world, nothing can be said to be certain except for death and taxes. So the question for tonight is, how will you live your final years? Now, and when you think about those final years, you have to think about what the leading causes of disability are. You know, first is arthritis and other structural problems. You have heart disease and stroke, cancer, mental health issues, and diabetes. And to go into a little bit more detail, arthritis is the leading one, makes up 1/3 of all disability cases. In fact, 1 in 3 people say arthritis affects their ability to do their jobs. And, you know, when we talk about structural problems, we're talking about bad backs, you know, bad hips, bones that just don't mend. And when you talk about heart disease and stroke, that can be extremely debilitating. You know, if you've ever seen anyone that's had a stroke, you know, it often impairs them for the rest of their lives, and oftentimes they will not return to 100% function. Also, heart disease is now the reason for 17% of all health costs in America. Cancer, it just seems like we hear a lot more about cancer nowadays. for whatever reason. And while cancer itself can be disabling, treatments such as surgery, radiation, and chemotherapy can also make it very difficult to work. And it is the fastest growing cause for disability claims. And why, you may ask? Well, we've had so much cancer and we have gotten so much better in treating cancer in this country, and people are living longer. You know, sometimes they're going through 2 and 3 rounds of cancer, but these treatments are becoming more and more effective for cancer, and people are living longer. Mental health problems. You know, you might think of disability as purely a physical issue, but mental health problems can make work very difficult or impossible with things such as depression, bipolar disorder, and other psychiatric conditions. Surprisingly, mental health problems are the most common reason that people file for Social Security disability. Diabetes, it's becoming more of an epidemic. Diabetes is becoming more and more common. Typically, it starts in adults. And the good news with diabetes is when it begins, it can initially be controlled with diet and exercise if it's a true type 2 diabetes. So we're going to look at these two men in the picture here. And we're going to envision life at age 80. So the guy on the left has disabling pain and a very low quality of life. The guy on the right, he looks like he's having a great time, playing some tennis, feeling great, very high quality of life. Maybe he's doing a couple crossword puzzles every day, going for walks along the beach. And you have to ask, what is the difference between these two? And the obvious answer is that their health is different. And we're going to talk about specific strategies to help you age gracefully. And you have to know that it's not a magic pill or a magic formula that helps people be healthier when they become older, but rather it is a recipe consisting of multiple ingredients. And so the first thing I want to point out is that drugs are not the answer. And so if you can't read this shirt, I'm going to read it to you. This shirt says, "I take metformin for the diabetes caused by the hydrochlorothiazide I take for high blood pressure, which I got from the Ambien I take for insomnia, caused by the Xanax I take for the anxiety that I got from the Wellbutrin I take for chronic fatigue, which I got from the Lipitor I take because I have high cholesterol, because a healthy diet and exercise with regular chiropractic care and superior nutritional supplements are just too much trouble." I don't know about you, but frankly, I'm pretty exhausted just by reading that. I think I'd rather go in for chiropractic treatments 2 or 3 times a week and eat sensibly than turn my stomach into a chemistry laboratory. Now, the senior population, we're talking about people aged 65 years and older, comprises almost 14% of the population. But sadly, they use 40% of all prescription drugs. And on average, if you're between the ages of 65 and 69, on average, this group fills 14 prescriptions per year. And when you get to the 80 to 84 range, on average, that number jumps up to 18 prescriptions per year. Now, just to talk for a minute, I'm in my 40s. I, on average, probably take 1 prescription a year. I might take amoxicillin for a couple days, twice a year for an acute sinus infection, and that's about it. Now, some people might say, well, that's kind of the extreme. You know, you are a chiropractor. I can tell you that most patients that come into my office do not take a lot of medication. I mean, of course, a lot of your females are on birth control. You do have the occasional high blood pressure medicine for, some patients. But for the most part, patients that take responsibility for their health try to avoid prescription drugs if they can help it. And that is the honest truth. The typical patient that we see that receives chiropractic care for years and years, they tend to eat sensibly, exercise, receive massages, take better care of themselves. They take responsibility for their health. And that's the honest truth. So one of my goals for you, even if I don't see you in my office physically, like to encourage you to improve your health so that maybe you can take less prescription medication. Now, I don't want to say drugs are all bad, because there are times when you absolutely need it. I'm just saying that, if you take responsibility for your health, that will limit the amount of drugs that you need to take. Now, drugs are a big problem, and I'm going to quantify this here. The US comprises 5% of the world's population, but yet we consume 75% of the world's prescription drugs. Does that sound reasonable to you? To me, the answer is no, with like 100 exclamation points after it. No way. And according to Time magazine, the US healthcare ranked worst in the developed world. And although the US has the most expensive healthcare system in the world, the nation ranks lowest in terms of efficiency, equity, and outcomes. And to go a little bit further on this while we're diving into research, according to a Bloomberg study in September of 2016, the US healthcare system ranks as one of the least efficient. We were ranked 50th out of 55 developed countries in 2014. On average, we spend over $9,400 per year, and our life expectancy was 78.9. The only countries that rank lower than us are Jordan, Colombia, I can't even pronounce this one, Azerbaijan, that's a good guess, Brazil, and Russia. And the US has lagged near the bottom of the Bloomberg Healthcare Efficiency Index since it was created in 2012. So this guy here points out that there has to be a better way, okay? This guy beat anorexia, obviously. So don't worry, though. There's no need to fear. We're ready to dive into the next section here, where we're going to talk about strategies. So help is on the way. So we're going to get started now. We're going to start turning your life around from this next slide forward. So we're going to begin with obvious strategies. So number one, don't smoke. I mean, that can't be any more obvious. Lung cancer obviously is a bad risk. Keep a healthy weight. Again, that's obvious. You want to reduce your incidence of diabetes, heart disease, all kinds of other problems. You want to exercise regularly. And one thing that's very important that is often overlooked is you want to maintain strong social relationships, including a stable marriage, if applicable. So at UCLA, the School of Medicine there did a study, and what they found was that adults in their 70s, over a 7-year period, those that had satisfying social relationships remained more mentally alert over the course of the study, with less age-related mental decline than people who were more isolated. And so the first strategy here in terms of other strategies is just keep moving. Exercise, go to the gym, go to your YMCA, go to your senior center. There are all kinds of things you can do, but keep moving, keep active. Another thing is socialize at your senior center. And if you live here in the Bloomington-Normal area, there is a fantastic senior center that opened in the last year or two. It's called the Activity and Recreation Center. And the information here is on the screen. Their phone number is 309-888-9099. I have several patients that have just plugged this place and talked about how great it is and how it's really affected them positively, improved their life. And I just can't say enough good things about this place. I have some patients that just swear by this place. So if you're a senior citizen and you're feeling isolated or lonely, give these guys a call, go over and make some new friends. I guess they have some killer euchre games, and they have all sorts of activities and fun things that you can do over there. Also, you want to stay involved in family gatherings and call on friends. Again, isolation is very bad for your mental health. If you can go back to school, that's a good thing. You want to keep your brain active. That might involve doing a crossword puzzle every day, or reading, just things to keep your mind active. Getting a pet is good. Maybe not a puppy. They might be stressful, but a pet provides for great companionship. You can go for a walk with them every day. Playing games, we talked about that. Also, making a deeper spiritual connection is something I'm real fond of. We're talking about religion and the community that goes with it. Also, volunteering is great. It's one of the best ways to add meaning to your life. And also, the last thing here is being thankful. Attitude is everything. Most negativity comes from an ungrateful attitude. So you should have an attitude of gratitude because it really makes a huge difference. So the next thing we're going to talk about is massage therapy. So I know some very good ones if you need any names, but in terms of benefits for seniors, massage therapy has been shown to improve the quality of life, improve self-esteem, improve sleep, reduce stress, anxiety, depression, loneliness, and help with muscle aches and headaches, and speeds up healing from injuries and illnesses. Also, nutrition is huge. Now, to talk about a specific nutritional plan is way beyond the scope of tonight. On the left, we have eat here, live longer, eat some good food that's healthy for you. On the right, eat here, die happy. The key with eating is to eat sensible, and obviously we're not going to get into a nutritional discussion in great detail tonight, but you know what's good for you and what's not. If you go to McDonald's and get a triple cheeseburger with supersized fries and humongous Diet Coke, that's obviously not going to be good for you. If you eat some spinach and green leaves and organic fruits and vegetables and salads, obviously that's going to be good for you. So most people have a pretty good idea of what is good or not good for them. It's just a matter of following through on it and being disciplined. In terms of the elderly's nutritional needs, two big ones I want to point out are calcium and vitamin D, because you want to maintain that bone health. So you can have milk and yogurt each day, or calcium-rich foods like cereals, fruit juices, dark green leafy vegetables. And also sunshine produces a lot of vitamin D. So especially during these summer months, get outside, get some sunshine. I got some today, and it elevates my mood. I'll tell you, spending a few hours in the sun really does a lot of good for you. Now, the next section is exercise. We talked about that earlier, but we're going to get a little more specific. Now, endurance or aerobic activities are good. They improve your cardiovascular system. They increase your breathing, heart rate. Brisk walking and jogging, dancing, swimming, biking are examples. But one thing to point out is that you want this to be non-weight bearing. If you've got degenerated knees, you don't want to be training for marathons when you're 75 years of age. Your knees could wear out, your hips could wear out. Just use good judgment with that. If you've got bad knees and they're very degenerated, don't go run 15 miles a day. Maybe ride a bike or do some swimming. Be sensible with your exercise. Also, doing strength exercises are good. They make your muscles stronger. They keep your muscles from atrophying or wasting away. It helps build strength. Again, another caution here is be careful not to lift too heavy with weights, as you're more susceptible to injuries such as tendinitis, bursitis, sprains and strains, and other types of injuries. Also, balancing exercises are really good. They help you prevent falls, and they also help improve what's called your proprioception, and it helps with coordination. Also, flexibility is good, like stretching exercises. They help your body stay limber. And the final topic we're going to talk about tonight, we saved the best for last. We're going to talk about chiropractic. Chiropractic is definitely a healthy choice, not just for pain, but for improved overall health. In this first slide here, we talk about how chiropractic works. So I'm going to break it down real simply for you. Your brain controls every single function in your body. So your brain controls your body through a bunch of impulses through a system, a network system known as the nervous system. And so we want that nervous system to function at 100% if possible. And there is one thing that interferes with that nervous system, and it's called a subluxation. Okay, so chiropractic, what we do is we correct subluxations that cause interference to that nervous system, and this allows the brain to properly communicate with the body, which improves overall health. Now, you might be asking, what's a subluxation? What's a subluxation? And that's a great question. A subluxation is a misalignment of the bones in your spine. Very simply put, it's when you have bones out of place in your spine. And when you have bones out of place in your spine, they irritate the nerves that come out from them, from the spinal cord, and it causes the nerves to not function right, causes all sorts of problems in your body, pain, tingling, numbness, but also causes dysfunction, causes your body to not work the way it's supposed to. So chiropractic corrects these subluxations. Now, going on to the spine and arthritis and degeneration, you'll notice that there are 4 phases of arthritis or 4 phases of degeneration. I won't get overly detailed with it, but I will show you something with my cursor here. If you have a textbook normal curve in the low back or the neck, you have a 35 to 45 degree curve here. Phase 1 of degeneration is you lose that curve. So if you imagine each vertebrae here, 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 here being bricks, what happens, it's kind of like if you have a 100-story skyscraper, what happens is you'll have more pressure on the first and second floors than you will on the 98th and 99th floors. What happens, you start to get some compression down here, and these discs start to get abnormal wear and tear on them. The discs are the shock absorbers in between each bone, right? And so this can cause discs to bulge or to herniate. And then if it gets into phase 3, it worsens. Those disc spaces are essentially obliterated, and you get some bone spurs in here too. And then if it is left untreated, it goes to phase 4, where everything is essentially fused together, and there's nothing we can do to correct your spine at this point, and it may require surgery. However, we do have patients that come in phase 4. We are able to manage their symptoms, but if they had come in when they were in phase 1, obviously it would have been a much better outcome for them. The key point with this, though, is that chiropractic slows down this arthritis process. So the sooner that you begin chiropractic care, the better. And we're going to talk about the top 7 benefits for seniors that receive chiropractic care. So the first is pain relief. Obviously, you feel better when you get adjusted. When you get adjusted properly, it should feel like someone turned on a light switch and your power was turned on, and you feel less pain, maybe no pain. Maybe you didn't have any to begin with, but it just feels like you have more energy, more vibrant, more vitality. You feel better. Your body functions right. You sleep better. You just have less anxiety and stress. I mean, it just puts your body in a complete state of ease. Second thing is it increases range of motion, improves your flexibility. The third thing is it increases your balance and coordination. It makes you more coordinated so you don't fall down. Number 4, decreased joint degeneration, so it slows down the arthritis process. Fifth thing is it increases health and well-being, which happens by improving the function of your nervous system. The sixth thing is it makes you less likely to fall. And the 7th thing is you are less likely to need assisted care. Now, what I'm about to say is very important. We have a lot of senior citizens that come into our office, and I can tell you that those that have been under chiropractic care for many years, when you compare them to the senior citizens that have come in that have never had chiropractic care in their life, there is a huge difference, huge. The patients that come into my office, I have some patients that come in that are 80 that look like they're 50, 55. They have the youthful enthusiasm of 40 or 50-year-old, 30-year-old even. I mean, their spines look better. They function better. They have more energy. They're out in their yards gardening and cleaning their garages and doing all sorts of yard work. They're going on trips, just enjoying life so much more than those that I've seen come in that have not been under chiropractic care. I'm just telling you personally, there's a huge difference. So if you've been thinking about chiropractic care, highly recommend it. We always offer a free consultation too if you really want to come in and talk about it in detail. If you're serious about it, I'll sit down and talk with you for 10 or 15 minutes. This slide here, this really hit a nerve here, but you only get one spine. And seeing that spinal disorders are a leading cause of disability, you better take care of your spine. Because once you get bone spurs and arthritis and it fuses together, sometimes there's just nothing you can do. So you have to make sure you take care of the spine that you have now. It is essential for your overall health, because when you get older, you don't want a degenerated spine. You want it to age as gracefully as possible. So if you're thinking about chiropractic care, get an appointment, before it's too late. And I always close with the new patient offer. If you have thoughts of coming in to see us, or if you're not in the area and you want to go somewhere else, great. Chiropractic care is amazing, and there are so many good chiropractors out there. But if you are thinking about coming in to see us, we have an offer. So our offer includes a consultation history. So when you come in on your first visit, you can sit down with us. We'll take a thorough history and ask you about your neck pain, your back pain, how long it's been bothering you, what are your goals, what is this keeping you from doing. We'll sit down and discuss that thoroughly with you. We'll also do a complete nervous system scan. So we do like a rolling thermal scan that shows how your autonomic nerves are doing. We do a surface EMG that shows how your motor nerves are functioning. We do a pulse wave profiler that shows how your heart rate variability is doing. And we won't get into a lot of detail on that. That's not the point tonight. We also do a complete neurologic, orthopedic, and chiropractic evaluation. We take a full set of digital x-rays. And then we invite you to come back for your second appointment, where we do a report of findings consultation, where we go over everything that we found on day one. And we do all that for only $125. That's essentially what we bill for the digital x-rays. So that is our new patient offer. So if you would like to come in and see us, we would love to have you. Our phone number is 309-663-9900. So I want to thank everyone who has tuned in and watched this. And if there's ever anything we can do for you, please don't hesitate to give us a call. Thank you so much for your time. I hope that you found this to be informative and helpful. And we hope that you all have a great evening. So take care and good night.